So how does Ebola work? Ebola is spread from host to host. Researchers believe that the virus is animal-borne and that bats are the most likely reservoir. 4 of the 5 strains of Ebola occur in an animal host native to Africa. The Ebola virus is diagnosed using ELISA testing, IgM-ELISA, PCR, and virus isolation. Early diagnosis for Ebola can be tricky, though, as many of the symptoms are mild and nonspecific, such as a fever. Zika, on the other hand, is usually spread through infected mosquito bites, but can also be transmitted sexually through male semen. Zika is a flavivirus that is closely related to the yellow fever and the West Nile virus. 2 main lineages exist, the American lineage and the Asian lineage. Phylogenetic studies show that the type of Zika found in the Americas is 89% identical to African genotypes, but is closely related to the Asian strain of the disease. Diagnoses are made based on blood and urine tests. Currently, there is no FDA-approved vaccine or medication for Ebola. Instead, the symptoms of Ebola are treated individually, usually by the use of an IV to balance electrolytes. Experimental vaccines are currently underway but have not yet been released to the public as they haven't been tested for safety measures. There is no FDA-approved vaccine or medication for Zika either. Like Ebola, the symptoms of Zika are treated individually. Symptoms include fever, rash, headache, joint pain, conjunctivitis, and muscle pain. Infection of the Zika virus can be confirmed through a blood or urine test. The CDC is always trying to track the spread of Zika, train disease detectives to find and report Zika cases, train medical providers to be able to identify Zika, and educate the public about Zika. As far as future implications of the disease go, Ebola is not likely to become widespread in the Western world because of how well it can be contained and isolated through strict isolation and medical preventative measures. The biggest implication of the Zika virus is the unknown. Researchers are still working to understand the limits of Zika, as many cases go unnoticed. Oftentimes, babies infected with Zika falsely appear to be healthy. Due to Zika going unnoticed, the baby's brains could lag in growth, resulting in permanent brain damage and even stillbirth. Overall, it is clear that both Ebola and Zika are potentially fatal diseases that can be spread through male semen. Not many people are aware of these diseases or the extent of them, and it's important to educate the public so that we can implement preventative measures. Some preventative measures to consider are condom usage during sex and treatments for viral infections. Ebola and Zika will most likely continue to be contained to small outbreaks in the United States as long as health and safety precautions are followed. Listed here are the sources used. Thank you.